Dr. Tammy Cassis was featured in the Fall-Winter 2009 edition of New Beauty magazine. New Beauty is the world's most unique beauty magazine and is the first publication devoted exclusively to everything beauty, from medical to spa to mainstream treatments. New Beauty educates consumers about the latest advances, inside secrets, must-have products, and expert advice. With a distribution of approximately 500,000 copies per issue, New Beauty is available for purchase at 40,000 retailers in the United States. Pick up your copy today to learn more about the 10.2 million surgical and non-surgical cosmetic procedures that were performed in the U.S. in 2008. To learn more about Dr. Cassis, call 326-8588 or visit www.cassisderm.com.
Welcome to Inside Talk on Cosmetic Surgery. I'm your host, Ann Guetta, and today we're at the office of Dr. Tammy Cassis. She's a board-certified dermatologist who will be discussing with us the recently FDA-approved filler Sculptra. Welcome to our show, Dr. Cassis.
Thanks for having me.
Now tell us, what is Sculptra? It's been dubbed the liquid facelift. There's a lot of excitement about it. Tell us what it is and who is it appropriate for?
Sculptra is a liquid injectable implant made up of poly-L-lactic acid, and we use it cosmetically for patients that have lost volume in their face to give them the quote-unquote liquid facelift.
Okay.
We also use it medically for HIV patients with HIV lipoatrophy.
Okay, so a little bit about the history of Sculptra. How long has it been around?
Sculptra has been around in Europe since 1999, used both medically and cosmetically. In 2004, it was FDA approved in the United States for HIV lipoatrophy patients, and then recently in 2009 for cosmetic patients.
Okay, so who is really an appropriate candidate for Sculptra injections, and then on the other side, who would not be able to receive these injections?
Appropriate candidate is someone that has lost volume, so can start in the age 30s, 40s, 50s, and on up. Sculptra is wonderful for a person that has lost volume in their cheekbone area, preauricular or close to their ear area, their marionette lines, even in their temporal area, so to give the appearance of a facelift. It's a series of injections.
Okay.
It's usually done 4 to 8 weeks, on average 6 weeks apart, and it's 1 to 2 vials per injection. A not appropriate candidate is someone that's pregnant, breastfeeding, someone that has problems with forming keloids or hypertrophic scars, and then someone with something called a collagen vascular disease. It wouldn't be a smart candidate to do Sculptra.
Okay, now can someone receive these injections in the hands as well, or the lips?
Definitely in the hands. The lips, we want to stay away from the lips with Sculptra. Not a good place to put it.
Okay, now how long do the injections last in the face?
The injections themselves, you'll have the initial volume effect of the Sculptra being injected, and that will last for about 72 hours. And then over time, it's stimulating your own collagen. So that's why long-term it's going to last anywhere 2 years and longer.
So it's really more of a permanent filler than we've had before.
We classify it as a semi-permanent filler, not a permanent filler, but
great.
yes.
So patients can get the injections. Now, after the initial 2 years, then they need to do another series or just maintenance?
Most likely just maintenance. You're just going to have to see how the patient responds. It's the same thing with how much they are going to actually need. It's really getting a good consultation to see exactly what they're going to need.
Okay. How do you combine Sculptra with other cosmetic enhancement procedures in your office?
Sculptra is just one tool in the toolbox. You could easily use it with Botox. I wouldn't necessarily recommend doing it with laser or with chemical peels right off, because this is stimulating your own collagen, so you want that to take effect, and then you can layer those things on top of it.
Okay, now can patients get the injections before a special event, or is there any bruising or swelling, or what kind of side effects?
Side effects with Sculptra, you could definitely have some bruising, some swelling. We mix numbing medicine within the Sculptra when we mix it up, so you'll feel numb. So you probably don't want to do it right before a big event, just in case you do bruise.
Okay. Now, what is the price for a series of Sculptra injections?
Sculptra is priced per vial, and so most injection sessions are 1 to 2 vials, and it's anywhere from $800 to $1,000 per vial.
Dr. Cassis, is it important for patients to get these injections at a board-certified doctor's office?
Absolutely. You want to have an adequate consultation to see if you're an appropriate candidate for Sculptra, to discuss how many vials you will truly need. And you want it done by a board-certified either dermatologist or a plastic surgeon.
Now, what kinds of training do you receive before administering Sculptra injections?
To be a board-certified dermatologist, you have to go through 4 years of medical school, 4 years of dermatology training, which you are learning all about Sculptra the whole entire time,
Okay.
Doing hands-on injections. And then once you become board-certified, then you have to, the company wants you to do advanced training. So
Okay.
you have to go through advanced training with Sculptra. It's very important. It's very technique dependent.
Okay. Dr. Cassis, tell us where patients can find out more information about Sculptra.
You can go to www.sculptraaesthetic.com, or you can look at my website, www.cassisderm.com.
Thank you, Dr. Cassis.
Thanks for having me.
Now stay tuned as we go into the next segment where we'll see Dr. Cassis, Dr. Kelly Webb, a dermatologist from Lexington, Kentucky, as well as Dr. Rebecca Fitzgerald, a dermatologist from Los Angeles, perform Sculptra injections on several of Dr. Cassis's patients.
Dr. Tammy Cassis uses the most advanced treatments to enhance your beauty. The groundbreaking injectable filler Sculptra has been nicknamed the liquid facelift because it provides exceptional results without the need for surgery. Sculptra restores and corrects a sign of facial fat loss by replacing volume. Most patients only require 3 treatments, with results lasting up to 2 years. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com.
We're back again with Dr. Cassis, Dr. Fitzgerald, and Dr. Webb, along with patient Marcia, who's going to be receiving Sculptra injections for her first time. Welcome to our show, Marcia.
Thank you.
Now tell us, are you excited to be receiving Sculptra injections?
Yes, very.
Okay, so
Very.
this is your first time. You're a little
My
nervous?
first time. No, actually, I'm not, because I have confidence in Dr. Cassis.
Good. And you've received other fillers before?
Yes.
Okay.
Yeah.
Marcia's had Juvederm, she's had Restylane, she's
Okay.
actually had Evolence. And you've had Perlane also, so she started talking about how she was losing some volume in this
Okay.
area here. And so, Sculptra was one that came to mind, so I thought she'd be an excellent candidate for Sculptra.
Great.
Yes.
Okay.
I'm looking forward to it.
All right, we'll get started then.
Okay.
Okay, so just like all the other times, first couple sticks you're gonna feel, sorry about the little pinch. A little bit different because I'm going to keep on doing serial injections. And then once we're all done, the key to Sculptra is that you're going to have to massage. So we'll massage for you to teach you how to do it. And then I want you to massage for 5 times a day for 5 days for 5 minutes.
555.
555, you
That's
got
easy to
it.
remember, right?
Yes.
All right. Okay, so we actually have marked out Marcia before the show, so I know exactly where I'm going. So here we go. Okay. First couple sticks here. I'm sorry. So I think it's important. Marcia can kind of talk about the difference between having Sculptra injected and the other fillers.
How does it feel pain-wise for you?
I really have a high pain tolerance because I spent the first half of my life at a dentist.
Oh.
She does have a high pain tolerance. Most of my patients tell me that Sculptra is less painful for them.
Okay, then other injections. Okay.
Sorry.
Now, how many injections will Marcia need to see optimal volume building in that area?
Sculptra is per vial, and we're going to actually do 1 vial per side.
Okay.
It is so far less painful than Restylane. It could be the area or it could be the product, but I don't feel any pain.
Okay, so new area here, I'm going to get you. Sorry.
I'll take your syringe.
So you can see with the volume, she's already starting to get a little bit of a natural lift. That's going to guide us. This is very, just the volume that we're seeing initially, because Sculptra is slow to react. So we're going to see the natural volume here.
So you see immediate results somewhat right afterwards, and then...
Right, but that's the volume itself.
Right.
Sorry. Doing okay?
Fine. It really is
She's a real
not.
trooper.
It really is not painful. It really isn't. I mean, I can feel,
Little pinprick.
yeah, or maybe the fluid entering, but I don't. It's not painful.
A little tiny bit.
I'm going to get you here.
That looks great. Looks really
Really?
pretty.
You
Gotta
can
run out and
see.
get my picture.
Yeah, you ready for your close-up?
Yeah,
I
it
think.
really did lift, yeah.
So we just gave her, Sculptra is marketed as the liquid facelift, and so what we're trying to do is restore her loss of volume. And so we've done one side, and you can already tell where it's, pulled up, filled up. And I'm going to do just a little bit more down in this area here and a little bit right there, but this looks fantastic.
It feels different.
Yeah, because it's
Maybe
all...
right here.
How does it feel as compared to the other fillers when you had them injected?
It feels more like me,
Right
or
under the
like
temporal fusion.
like I
line. It's
used to
really,
be,
really
maybe.
good.
it feels very natural, but it feels
Starting to feel
Tighter.
numb, huh?
Yeah.
yeah, it feels tighter. I don't have that. I wasn't that aware of being that loose, but
I'm going to get you down here, and then I'm going to get you just a little
Okay.
bit up here. Okay. Raise your eyebrows up for me, and then just relax.
So you can do kind of a brow, lifting of the brow area.
Exactly,
Wow,
exactly.
That's unbelievable.
Perfect. Thanks.
And then the jowls. We're going to put just a little bit of a depot right there to help with the jowls that she's got.
Okay.
Okay, so new area. I'm going to get you here, okay?
okay.
All right, I'm sorry.
Perfect.
Maybe just a little bit more here. All right, great.
Would you like a mirror?
That really lifted up that area. Wow, look at that, Rachel.
16 here,
You look 16. Look at that.
just like my high school picture.
See that?
Dr. Tammy Cassis uses the most advanced treatments to enhance your beauty. The groundbreaking injectable filler Sculptra has been nicknamed the liquid facelift because it provides exceptional results without the need for surgery. Sculptra restores and corrects a sign of facial fat loss by replacing volume. Most patients only require 3 treatments, with results lasting up to 2 years. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com.
Now we're here with Dr. Cassis and patient Mary Sue, who's receiving her 4th round of Sculptra today. Welcome to our show, Mary Sue.
Thank you.
So this is your 4th time receiving Sculptra injections. So
Yes.
Tell us what kind of results you've seen and the changes.
Oh, I could tell a huge difference already with the fullness more in the cheek area where it was really sunken in. I can tell that, and a lot of the wrinkles are disappearing, so that's what I'm looking for.
Okay. So what are we gonna?
This is going to be her 4th and final injection
Okay.
with Sculptra, and then we're going to let Sculptra do what it needs to do, just take time to stimulate her own collagen. And then we may have to go back and do some fine lines with, you know, a Restylane or a Perlane or a Juvederm essentially on top. But Mary was just having so much trouble with her volume loss that she was starting to get the deeper wrinkles that she was an excellent candidate for Sculptra to try to rebuild what she lost.
Okay, and how long between injections do you normally wait?
It's an average 4 to 8 weeks. I usually try to do about 6 weeks between the injections, 1 to 2 vials. And so each time Mary has done 2 vials, and we'll do 2 vials again today.
Okay, let's get started.
All right, you ready, Mary?
I'm ready.
Okay, you have any questions?
And
Okay, remember the first couple sticks are the worst, and then you're gonna go numb. All right, just try not to smile. Just try to relax for me.
Even that whole swath right there.
Okay, I'm gonna get you here. All right, we're ready. Sorry. So Mary too has also had Restylane and Juvederm, so she can
The
talk about
Botox.
the Botox.
How's the pain with this injection versus the others you've had, Mary Sue?
it's not painful at all. I mean, maybe a 4.
Okay,
Yeah.
that's good to know.
You do go numb, so it's kind of a weird sensation. So that's a little bit of a, kind of like going to the dentist, I guess would be the right way of saying it. All right, I'm going to get you up here. Okay, ready?
So the key is to massage it afterwards.
Yes. Immediately afterwards, we'll do a brisk massage, and then it's important for the patients to do massage for 5 minutes, 5 times a day for 5 days.
You can already see the lift.
That's pretty cool. The immediate gratification will wear off in 24 to 72 hours, and then you'll go back to your original volume loss, and then over time, it'll stimulate what's been lost. Okay, Mary, so I'm going to do around here, your favorite place, okay? Okay, ready? Sorry. We want just a little bit of a lift here to help with the nasolabial fold lines there.
Will she need to get maintenance injections, or how long will this last?
Sculptra, at the very minimum, will last close to 2 years.
Okay.
I've seen patients last longer than that, so she may need to do more of the maintenance for the fine lines, with the actual volume itself. Doing okay?
Mm-hmm.
Great. Okay, then I'm just going to do a little bit down here, okay? Feeling good and numb?
Oh, yeah.
So I guess, do people get this done like before a special event because of that immediate
They
lifting?
can. The only risk with that is that you may bruise, and
right.
so they get an immediate response, but if you bruise, then it's sort of...
Because it's pretty dramatic right
Yeah,
away.
yeah, it's pretty cool. All right, so down here, I'm sorry.
Maybe save a little bit to just immediately preauricular.
All right, we got one side done. We'll get the other side done.
Dr. Tammy Cassis uses the most advanced treatments to enhance your beauty. The groundbreaking injectable filler Sculptra has been nicknamed the liquid facelift because it provides exceptional results without the need for surgery. Sculptra restores and corrects a sign of facial fat loss by replacing volume. Most patients only require 3 treatments, with results lasting up to 2 years. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com. Dr. Tammy Cassis was featured in the Fall-Winter 2009 edition of New Beauty magazine. New Beauty is the world's most unique beauty magazine and is the first publication devoted exclusively to everything beauty, from medical to spa to mainstream treatments. New Beauty educates consumers about the latest advances, inside secrets, must-have products, and expert advice. With a distribution of approximately 500,000 copies per issue, New Beauty is available for purchase at 40,000 retailers in the United States. Pick up your copy today to learn more about the 10.2 million surgical and non-surgical cosmetic procedures that were performed in the U.S. in 2008. To learn more about Dr. Cassis, call 326-8588 or visit www.cassisderm.com.
To recap our show today, keep the following main points in mind. Number 1, make sure your physician is either board certified in dermatology or plastic surgery and has the appropriate credentials as well as experience in injectables. Number 2, be sure to inform your physician of any medications you are taking as well as any medical conditions you have in order to ensure the best and safest possible outcome. Number 3, remember that Sculptra injections require multiple treatments in order to obtain optimal results, so be sure to take that into consideration when planning the injections before a special event such as a reunion or a wedding. And finally, number 4, remember that Sculptra injections can be combined with other cosmetic enhancement procedures such as IPL treatments, chemical peels, Botox, and other fillers, so be sure to schedule a full cosmetic consult with your doctor in order to ensure that you receive the best possible treatments for your particular skin issues. Thank you for tuning into this edition of Inside Talk. Please join us next time as we explore more exciting topics in the arena of cosmetic enhancement. We'll see you soon.
Dr. Tammy Cassis uses the most advanced treatments to enhance your beauty. The groundbreaking injectable filler Sculptra has been nicknamed the liquid facelift because it provides exceptional results without the need for surgery. Sculptra restores and corrects a sign of facial fat loss by replacing volume. Most patients only require 3 treatments, with results lasting up to 2 years. To learn more, call Dr. Cassis at 326-8588 or visit www.cassisderm.com.